I just want to do a little public service announcement that if you're planning on going gluten-free, please get a blood test for celiac disease just to rule that out prior to taking out gluten from your diet. Main reason is because once you go gluten-free, any blood test that you get for celiac disease now could be a false negative because gluten's no longer in your system, so your body's no longer reacting to it. So you might not have a high amount of antibodies, not because you don't have celiac disease or are at risk of celiac disease, but because you're not eating gluten. And let me tell you, if you go off gluten and feel a lot better, it is really hard to get you eating gluten again prior to a blood test, but we really just want to make sure we rule it out, particularly if you have gut symptoms, but even particularly if you have conditions like endometriosis or POTS or anything autoimmune or immune related, because some of those conditions can have a higher rate of people having celiac disease in them. Now, there are a few red flags that I'll look for if I'm suspecting someone might have celiac disease, but also know that you can be asymptomatic, so no gut symptoms, and still have celiac disease. I've had a couple of patients recently diagnosed later in life, and we've missed it because they didn't have gut symptoms. So I'm just going to pop up some red flags for celiac disease. Look, the chance that someone has it is low, but I always like to rule it out, especially before going gluten-free. Here are some of the red flags. Oh, that's me. There we go. If you've got any of these going on, so definitely the gut symptoms, iron deficiency or anemia, sudden unexpected weight loss, chronic fatigue, easily broken bones or osteoporosis, if your LFTs or liver function tests are up, even like mouth ulcers or impaired dental enamel, arthritis nerve pain, unknown infertility, or like I said, any other autoimmune or immune related conditions or family history. These are some of the things that make me want you to have a celiac test, just so we're ruling it out. And of course they can be down to many other things, but it's not hard to do. Get the blood test. Let's just make sure you don't have it.